India specifically, why are we seeing this uptick of diabetes? What is really the main causes?
The metabolic abnormalities, the genetic trait, physical inactivity, and the presence of obesity and overweight, all these contributes to the occurrence and worsening of the diabetes state.
Is there an increase in gestational diabetes, as we call it in India?
So there's a documented increase in diabetes occurring in pregnancy is becoming much more common, and earlier we used to see about 5 to 6%, which has gone almost more than 2 times or 2.5 times of that.
How advisable is it to think of pausing the medicines and working towards something which is very drastic?
Getting a good lifestyle to manage diabetes will control the diabetes, will give them, reduce the number of medications that these patients have. But that they'll be totally off medication, that's more or less a myth.
Hello everyone, this is Khushbu, founder at Zyla Health. On the very important occasion of World Diabetes Day, I have the pleasure to have with me Dr. Abhay Ahluwalia. He's a leading endocrinologist and leading name in the medical fraternity. Dr. Abhay has practiced for over 34 years, out of which 29 years were spent in the Indian Navy. Dr. Abhay now practices at Manipal hospitals. He is a graduate from AFMC Pune and he's done his DM endocrinology from the very prestigious AIIMS New Delhi. We thank Dr. Abhay and Manipal hospitals for helping us cover this very important topic on World Diabetes Day.
Thank you, Khushbu. Thank you for having me here, and it's always good to interact with people and give information on this very important disease called diabetes. And on this occasion of World Diabetes Day, it would be good to interact with your audience so that we can help them in clearing the doubts and help them in managing diabetes better.
Thank you so much, Dr. Abhay. I would also like to add that I have personally had the pleasure to know Dr. Abhay for 8+ years. In fact, when we started our journey of Zyla, Dr. Abhay has played an instrumental role in guiding us on how to proceed and how to help millions of patients combat chronic conditions. Thank you for that, sir.
Thank you very much.
So as we discuss about World Diabetes Day today and focus on this very important topic of diabetes, India is known as the diabetes capital of the world, and every day we have thousands and thousands of patients newly diagnosed with diabetes. Not just that, diabetes also unfortunately leads to many complications, that of the heart, kidney, foot and the eyes. It's very critical to understand why is this epidemic impacting India today so aggressively. Also, how can we prevent, how can we better manage, how can we protect our families from diabetes? So Dr. Abhay, to start with, would like to understand, basis your years of experience of treating so many patients, in India specifically, why are we seeing this uptick of diabetes? What is really the main causes?
See, if we look at the basic signs of diabetes or pathophysiology of diabetes, it's caused by 2 abnormalities. We're talking about type 2 diabetes, which affects 90% of the young adults. We have type 1 diabetes, which is basically an autoimmune disorder, which is because of insulin deficiency. But if we're looking at the 90% of diabetes, that is type 2 diabetes, that affects majority of people. The basic mechanism for type 2 diabetes is insulin deficiency and insulin resistance. So insulin deficiency occurs in a genetically predetermined manner. It's a kind of program within your pancreas and the beta cells. The second abnormality which makes the insulin deficiency manifest, or the manifest diabetes, is because of the insulin resistance. Now, insulin resistance is contributed by many factors. One is the genetic, the second is obesity, and overweight plays a very important part. And as our society is advancing, as our society is changing, we find children becoming very obese and overweight, and you've started getting diabetes in children. And the young adults who are running from small cities to the big cities, having a very not so great lifestyle, and the working hours also not so very human. So we increase the amount of overweight and insulin resistance among these people, and that results in manifestation of diabetes earlier. And that's a major reason. It's not only in India, it's across the world. The demography and the physical changes among the young adults is changing. So that's the reason we manifest diabetes much earlier than the other people or the Western society.
Thank you so much, Dr. Abhay. And in layman terms, if we had to explain to our audience what really insulin is or how it is important for a cell, right, for the metabolism, if you can just explain to our audience.
So basically, there are two hormones which regulate the glucose. The first one being insulin, and the other one is glucagon. So anytime, just to explain it to a common person, that every time you eat food, food contains carbohydrates, fats, and proteins. It's the carbohydrate metabolism which is the energy source for the body. So as you eat, the carbohydrates get dissolved, and there's going to be a increase in the glucose level of. As the glucose level starts rising, you require a hormone to put the glucose into the liver and push the glucose into the muscle so that it can be utilized. This work is done by the hormone called insulin. So if you have insulin in the right concentration, whatever food or carbohydrates you eat, they will go to the liver, they will get stored in the liver, they'll go to the muscles, they'll get stored in the muscle in the form of glycogen. Now, in the event if the insulin is not there or insulin is deficient, then what will happen is the glucose will start rising, and then glucose will rise so that the cells of the body may not be able to utilize it. So the key or the crux for utilization of glucose and other metabolites lies in the hormone called insulin. On the other hand, when the glucagon is the one, when the glucose levels are down, the glucagon is secreted and increases the glucose. So whenever you have an insulin deficiency, the glucagon excess, you have the net result, which you call diabetes, is high glucose or hyperglycemia.
Okay, got it. And sir, you used glucose a few times. There is also a lot of myth floating around diabetes. So just want to cover this aspect now, given that we are talking about the causes of diabetes, that is excess sugar intake the main root cause of diabetes, or is this really a myth?
See, what happens is the excess sugar intake is not the root cause of diabetes. The diabetes happens because your insulin is either not being produced or it's not being working effectively. So if everybody who takes excess glucose should develop diabetes, which doesn't happen. It happens in only 10 to 15% of the population. It happens in those 10 to 15% of population who don't have appropriate insulin reserves or appropriate insulin secretion or appropriate insulin action. Now, the excess glucose is not good for the general population because all the glucose which body utilizes will be taken in the form of energy. The excess is going to get stored. Now, the excess will get converted, so it will lead to increased amount of calories, which may not be. But excess glucose is not good for those people who already have diabetes. But it is not the root cause for diabetes.
Okay. So, sir, you also touched upon obesity and overweight when you defined why, India is dealing with this epidemic. So, are we saying that excess fat deposits then sort of lead to, say, insulin resistance, the root cause of type 2 diabetes?
Absolutely right. See, we have we have excess amount of few things which are peculiar with the Indian population. One, we have decreased insulin reserves. Second, we are sarcopenic. We have less muscle mass. So, and third is we have high amount of lipid abnormalities, which is high amount of triglycerides, and we have not so very active adipose tissue. So it's a metabolic disorder, which you call as a metabolic syndrome also, which you have high glucose, that is hyperglycemia, you have high fats, that is hyperlipidemia, and then you have inactive or less amount of muscles. So it all forms into a peculiar pathophysiology which is there in Indian population, that is called a thin fat Indian. So we have more fat for the amount of weight which the body has, and this is very different from the Caucasian or the Oriental population.
So you're saying this is an ethnicity challenge?
It's an Indian ethnic challenge, and this may be a factor which contributes to a slight earlier diabetes which has come. Besides the physical inactivity, increase in weight, so these factors also contribute to occurrence of the diabetes epidemic which you're seeing in our society.
Okay. So, sir, we spoke about the fat deposits which lead to overweight, obesity leads to insulin resistance. Also, we spoke about the inactive lifestyle, also the ethnicity itself, which could be a challenge. Are there any other factors because of which a person is put at risk of diabetes?
Physical inactivity? Second is the genes, which makes a difference. If you are genetically, if your parents have diabetes, or if your in uncles and aunts have diabetes, you are going around with the genes which will manifest diabetes. And in India, almost 80% of families would have somebody who's got diabetes in the family. So
Got it.
the metabolic abnormalities, the genetic trait, physical inactivity, and the presence of obesity and overweight, plus the lifestyle which you see it in bigger cities, all these contributes to the occurrence and worsening of the diabetes state.
Got it, Dr. Abhay. Very, very well summarized. And given you touched upon the genetic factors, there is another myth which or confusion that people have, that is type 1 diabetes only linked to the genetic factors, or is type 2 diabetes as well linked?
See, the type 1 diabetes is because of the absolute insulin deficiency. It is an autoimmune disorder where you have antibodies against the beta cells and the cell lining, which may be the cell membrane, which you call the islet cell antibodies. And so that almost finishes off the beta cells, and the patient doesn't have any insulin production. There are certain genes associated. There's an HLA link to type 1 diabetes. On the other hand, you have type 2 diabetes, which is a different disorder, which is contributed by insulin deficiency or insulin inaction and insulin resistance. There you have multifactorial inheritance. That means you don't have a single chromosome or gene which will contribute to diabetes, but you have multiple factors. So it's a multifactorial inheritance which runs in families. So we not identify, but what you do is you have a genetic pool which will identify that this population is more prone for diabetes.
Got it. Great, that clarifies a lot, Dr. Abhay. Thank you so much. I think there is another lingering confusion, especially in the young population today, and that is around pre-diabetes. So if you can clarify what really is pre-diabetes and help people understand if actually it is reversible.
So you said about three things in one sentence. One is diabetes. That's got a definite criteria. The other one is normal. And third one in between normal and diabetes is pre-diabetes. So first let me tell you what is diabetes. If you do a fasting plasma glucose, if it's more than 126 milligrams, you give 75 grams of glucose. Check the glucose after 2 hours, that is more than 200 milligrams. And if you do a HbA1c, which gives you a 3 months average glucose, which is more than 6.5, this is what you call as diabetes, and these people are treated like diabetes patients. Depending upon what your levels are, the treatment is decided. Then you have a normal values, that is HbA1c, 3 months glucose of 5.7, a fasting of less than 100, and a 2 hours glucose of less than 140. Now the intermediate, that is fasting of 100 to 125, post glucose or 2 hours glucose of 140 to 199, and HbA1c between 5.7 to 6.5. This is called pre-diabetes. Now this is very important because if you have 10 people with diabetes, 15 will be in the population with pre-diabetes. Now these pre-diabetes forms a large group where you can take health intervention, where you have been contributing. And then you can start with aggressive lifestyle modification. The aggressive lifestyle modification will have two components. One is the physical activity, and the second would be changing the diet and diet habit. So I will also add on to this. In 2001, there was a study published in USA that was called the Diabetes Prevention Program. Now these people who are in the pre-diabetes or impaired fasting glucose, they were subjected to intensive exercise under the supervision of health trainers. And for a good about 5 to 10 years, you could prevent the occurrence of diabetes in these patients.
Wow.
So, and there was also a drug component to it, but we will not discuss. So basically, it's important that the public is aware that they have to check their glucoses, they have to screen for HbA1c, and then self-motivation or using groups that you can start working on their health and lifestyle to prevent them or delay the onset of diabetes.
Thank you so much, Dr. Abhay. That's well said. So there is hope if someone has impaired fasting glucose levels or borderline HbA1c, we may call it, between 5.7 to 6.5, they can actually prevent occurrence of diabetes by taking lifestyle measures, as Dr. Abhay is mentioning. Great. And sir, if we talk about the weight aspect, right, because you said that weight contributes a lot to diabetes, the fat deposits, insulin resistance. So is there a correlation really between weight loss and diabetes prevention for such a cohort?
So basically, to assess scientifically the weight, we use the absolute weight. Then you look at the body mass index, and third, we look at the waist circumference. And now you have body scanners, DEXA scanners, which will give you body composition and fat composition. So if we look at the weight, that height and weight will determine. The second one is body mass index. If your body mass index is less than 25 kg per meter square, you are in the normal weight category. Over that, you have different grades of obesity. And third is, if you look at the body percentage fat, 25% in women and 15% or 20% in men. So you'll get, so if the fat and the weight contributes to insulin resistance, if we work on this, you will possibly, one, not only improve the physical attributes to a person, you'll also help in reversing. Or then these studies have been done where patients have got diabetes, early diabetes or pre-diabetes, you make them lose 15% of weight. You change them from dysglycemia, that is abnormal glucose, to normoglycemia, to normal glucose level. So it's important for you to send a message across to the society that yes, please start working on this.
Got it. That's very, very helpful, Dr. Abhay. Thank you so much. And when we talk about reversal, again, there is a lot of myths floating around this. We understand pre-diabetes can be reversed, we can prevent diabetes. But if a person has diabetes, until what stage can they even think about reversal?
See, the reversal, the scientific term of this reversal, which is going in the lay public and it's going in the social media, the diabetes reversal, and there are a number of people who are selling the idea of reversal of diabetes. Actually, the scientific term which has been accepted by the international diabetes associations is remission of type 2 diabetes. So remission means when you have instituted certain amount of measures, which is basically lifestyle, weight loss, exercise, you are able to keep the A1C below 5.7 and you are able to keep the glucoses below 100 and 140. And if you can maintain this for a period of 1 year, that is called the remission of diabetes, which is in the lay press or colloquially called the diabetes reversal. So in pre-diabetes, you can certainly reverse almost all pre-diabetes if the conditions permit. Secondly, if the diabetes is early, patients are obese who have a higher BMI, higher fat percentage, you institute drugs or institute lifestyle measures or maybe the change of food pattern. So you'll be able to let them lose about 15 to 20% of weight. They will get into what is called as clinical remission of diabetes. And then reversal doesn't mean that you had diabetes today and then afterwards your parameters are okay. You'll get back to the same original lifestyle. Those people who have corrected their metabolic abnormalities will have to continue with lifestyle, with the type of diet which they eat, so that they maintain their parameters in the normal range and they don't require drug therapy to control their diabetes.
Correct.
It's not that yes, today my diabetes is okay, so I'll be back on to Swiggy and Zomato and order whatever food which I like.
We will cover the diet aspects, sir. Thank you for touching upon that. You touched upon a very important aspect that reversal is very colloquially used in the society, what we call remission of type 2 diabetes. Sir, if you can also educate our audience that if someone, for example, has diabetes for 20, 25 years, they may be on insulin or advanced medicines, how advisable is it, right? They may get misguided sometimes because how advisable is it to think of pausing the medicines and working towards something which is very drastic? If you can just guide the audience on that.
So, it's a psychology that no one wants to be sick. No one wants to be dependent on medication. Nobody wants to do frequent tests and make medical visits and get the diabetes corrected. So with that, when you have social media in the form of Facebook or Instas posting that we will reverse your diabetes, everybody is tempted to get into this reversal program. The reversal, as the diabetes advances beyond 5, 10, 15 years of duration of diabetes, the insulin reserve of the body keeps coming down. So these people require either multiple drugs to control their diabetes or may require insulin to control. Getting a good lifestyle to manage diabetes will control the diabetes, will reduce the number of medications that these patients have. But that they'll be totally off medication, that's more or less a myth. Because if you have diabetes in the early stages, that is, if you are young, your diabetes in the duration of 0 to 5 years, if your body mass index is more than what is there, then following a aggressive lifestyle modification would put you into a normoglycemia category and put your diabetes in remission. But longer duration of diabetes, if you are insulinopenic, you are low body weight. So that means your insulin reserve is as it is less. If you try this reversal, will do more harm. And I've had patients ending up with diabetic ketoacidosis because they were on ketogenic diet that stopped their insulins. So this leads to a lot of complications, and this message has to go across to the patients that treatment of diabetes and controlling is more important, and using the therapy whichever your doctor has given appropriate to your particular disease condition is what is required.
Very, very important point, sir, that you brought up. So it's important to be under proper medical guidance and follow what your doctor is saying, and not go after a fad diet or a fad or an extreme treatment which may do more harm to the body than good.
Absolutely right. So basically, you have to everything. Even if there's a program you are following up with your doctor, please discuss with your doctor that this is come to me and what should I do. Maybe there are certain advantages. The diet gets modified, the diet gets okay, but then it has to be under medical supervision.
Okay, thank you, sir. And you touched upon the diet aspect so beautifully. So I would want to continue on that thinking now. Talking about diet overall, I would want to understand, and you also talked about, how food delivery or outside food can be a contributor. So in terms of risk factors first, what sort of diet must be avoided to even get to a situation of a pre-diabetes or a diabetes?
So we have to understand what our ancestors taught us is what you eat. So if you look at diet, it's got two major it's got macronutrients, that is carbohydrates, protein and fats. It's got micronutrients, which are vitamins, minerals and salt. So these have to be taken in a right proportion. Then the second is your meals have to be divided so that you distribute your energy and calorie intake so that's the reason why we have 3 meals. You have a breakfast, then you work. By the time your stores are being taken, you have a lunch and you have a dinner. So this is the meal timing which has to be followed. The second is your portion size and the balanced diet. So you have to have carbohydrates in small quantity, you have to have small quantity of fats, and you have to have proteins. So that what you say is ghar ka khana, which your mother makes. So she gives you chapati, she gives you a katori of dal, gives you vegetable and salad. So this is a equitable distribution of food products, which over a period of time, once children moved out of society, move out from their nests, now you have readily available food which is there. The problem of the foods which are available, they are high in carbohydrate and high in fat content. The protein content is less, so you consume you consume more calories than what you require. You consume more amount of fats, and most of the time you're not too sure about the kind of fats which are being used for cooking, so you may have more trans fats. So basically, it's not a question of if you're having it as a pleasure, it's okay. So be careful and choose the kind of meal which you want to have. Once in a while, if you do exercise, you earned your calories, you can take a reward of that kind of food.
Got it. So ghar ka khana is the best way forward. But Dr. Abhay, it's also said that Indian food is very rich in carbohydrates, right? We eat a lot of chapati, we eat a lot of bread, right? We love our parathas, right? We love our baturas. So do you think there is a correlation to that too? I understand, of course, outside food is the real culprit, but when it comes to even ghar ka khana, what is really the moderation there?
So to that effect, there's been a study which is called the START study, in which a number of endocrinologists were involved all across the country, north, south, east, west. So based upon that, it was found that the average consumption of carbohydrates, whether you are in North India or you are in West India, South India, was between 67 to 70%. Ideal carbohydrate consumption in Indian diet should be between 50 to 60%. The other aspect of that study was the protein consumption was very, very less. So, and most of the time, if I get a diet history of the patients, the amount of pulses, the amount of protein consumed by the patient is very less. So, generally, we as a society are dependent on carbohydrates, we should take that carbohydrates, maybe reduce, but increase our protein intake in the form of, if you are a non-vegetarian, you should take a healthy quantity of eggs and meat. If you are a vegetarian, then you are left with few dietary sources of protein in the form of dairy, that is paneer or pulses. So our consumption of legumes and pulses is very less, which should be increased in the society. So you'll reduce the carbohydrate, you'll increase the protein, you'll have a more balanced distribution of food intake.
So, Dr. Abhay, does that mean that vegetarians may be more prone to a disease like diabetes given their natural low protein intake?
See, our society, we are, as an Indian society, we are not hardcore meat consumers or non-vegetarian.
Correct.
Predominantly, that is taken as a luxury. So, overall, even if somebody consumes non-veg, the quantity of non-vegetarian food is less. So, we, across the country, we consume a lot of carbohydrate and predominantly vegan meal.
Okay.
So, you have to increase whatever the fruit consumption, salads in the form of fibers, so they reduce the quantity depend on. So, we have to get into a balanced diet, eat more natural foods, and that will reduce your dependence on carbohydrate and fats.
Got it, got it. And sir, you touched upon dairy as a concept, right? Is there a correlation with dairy and diabetes? Is there something to take note of here?
See, the amount of fat consumption, people in Haryana, we are part of that,
Right.
consume a lot of dairy, consume a lot of. So, the amount of milk consumption is less, which varies from state to state. It's the fat consumption which can, if you take processed in where the fat has been taken out in the form of curd or charge, so that will give you a better, the calcium and protein. So that you have to keep it in balance. It's not that absolute amount of dairy will increase the risk.
Got it.
If you get it in the right proportion, it will provide you with calcium, it will provide you with protein, it will provide you with the necessary minerals which are required.
Got it. And so there's a new villain in the block which is called gluten, right? So there's a lot of talk around avoid gluten, gluten intolerance, gluten-free food. What is your take on gluten and correlation with diabetes?
See, some people, what you call is celiac disease, some people have gluten hypersensitivity, those people. It's the gluten is the new villain, which is actually not, because it comes from wheat and others, which is the predominant energy giving food. So if you reduce the amount of wheat which you consume, it's not that you get into a totally gluten fat free or gluten fatism. So you may require, and it's part of wheat, which is a predominant source of carbohydrate. So you can reduce. It's the gluten. Maybe some people who have gluten hypersensitivity, there the gluten will have to be reduced or will have to be stopped.
And how does one predict whether they have gluten intolerance?
See, what you can, if somebody's got malabsorption, then you check the gluten, you do a transglutamase and look at the gluten sensitivity.
Okay.
That you have objective way of assessing that these people.
Got it.
Gluten, yes, if you reduce the gluten, you will obviously reduce the amount of carbohydrates, and then you'll say, I'm on a gluten-free diet, which may not be absolutely good for everybody.
Got it, got it. And so when we talk about pre-diabetes and diabetes and the correlation with sugar, right? So is sugar intake really a problem? What is the right amount? What types of sugar can be consumed by people who may have these conditions?
See, naturally, sugar basically is derived from sugar cane. So what you get is sugar is basically refined out of sugar cane. You have a crude form of sugar cane, that is jaggery. So if you look at jaggery, would have about 85 to 90% sugars of absolute sugars. Sugar intake adds on to, in diabetics, yes, because it adds on to the glycemic load. It's got about 90-95% glucose absorption from there. But for the rest, if you reduce the sugars, you reduce the amount of carbohydrate consumption. So maybe even if you want to consume sugars, you may take it. Once in a while, you can have a sweet, but try and use sugars every time, so you'll cut down. So that'll honestly put a burden on your pancreas. So basically, sugar consumption in a small or a moderate quantity may be beneficial as a form of taste. So if you can reduce the amount of sugar consumption, you are giving rest to your pancreas.
Got it. So Dr. Abhay, very well said, and understand that the processed sugars or mithai, what we usually called, or your cakes and pastries should definitely be taken in moderation or limited. What about naturally occurring sugars in fruits? Are they a problem?
See, they naturally occurring sugars in the fruits, they are fructose. They are not sucrose or glucose. And a small quantity of fructose will get. And if you eat a fruit, you not only eat the fructose, you also eat a lot of fiber.
Correct.
So these, the fructose which you get from, let's say, an apple or a guava, and there are certain fruits which are high in fructose contents like bananas or grapes. So for diabetics, you have to take them in smaller quantities. For somebody who's healthy, who's an athlete, consumes that, which you may see it in tennis matches,
Correct.
the players eating banana because that's a very rapid source of energy. But for these are good sugars. Somebody who's healthy, who's playing, who's running, fruits are good. Fruits don't really increase in normal people, doesn't increase the amount of glucose load. And they come with a lot of natural minerals and fibers. So those are healthy fruits. And if the fruits grown in organic manner are certainly better.
That's, sir, a fantasy most of the times for our country, but hopefully that will become true as well. So, Dr. Abhay, I also want to understand, when we talk about fruits, you did mention that, bananas and grapes are a little bit higher on the GI index, so should be taken in moderation, while an apple or a guava is a good fruit. So, which fruits do you usually recommend to your patients to be taken every day?
See, basically, it's the fruit. You first tell them to take about 100 to 150 grams of fruit a day. Not to take the food with the major meal because the carbohydrate intake of the food as well as the fruit will have it in between the meals.
Got it.
So, and then you can choose, all fruits have got apples, guavas, papayas, pineapples. These are good fruits which the diabetic patients can take. You tell them to take, to avoid bananas, but if you're taking a fruit salad which has got half a banana, some apple and some guavas, those are kind of healthy fruits for the patients also.
And even for people trying to prevent diabetes, these are
people, I think you reduce the amount of carbohydrate intake, eat a good quantity of fruit because it contains fructose, and burn the calories which you take.
Okay. Sir, you touched upon a very important aspect of calorie intake a few times. So I want to just touch upon that aspect now. When we talk about measurement or monitoring for a diabetes patient or someone who's trying to prevent diabetes, who's pre-diabetic, what is a good monitoring measure? Is it calories or is it the glycemic index?
It's a combination of both. So if you take foods which low GI index, suppose you have to take cereals, right? So now bajra is coming. So if you take bajre ka khichdi or bajre ka roti, it's got a lower glycemic index than wheat ka roti. So that would be certainly better. You take jowar, which will be certainly better than rice. So if you take the GI index, carbohydrates, rice followed by wheat, followed by jowar, followed by bajra, that would be, so if you can, if it's ingrained in you, you should take cereals with lesser GI index, then you should take it in right proportion. Take a small quantity, increase the quantity of pulses. So you would possibly have a carbohydrate sparing or you'll have reduced carbohydrate intake. So you have to balance out on these and don't take jaggery, or even if you want to take it in small quantity. Then second aspect is you have to, whatever you ingested, so you must be able to burn it also.
Got it. So it's important that you focus on the low GI food, especially if you're tending towards diabetes. And irrespective of diabetes or no diabetes, it's important to have some level of monitoring on your calories, that whatever you're ingesting and what you need for the
Absolutely.
day, the deficit.
If you now there are a lot of apps which are there, but a simple formula of about 150 to 200 grams of carbohydrate for somebody who's about 70 kg should be okay. A protein intake of about 40 to 50 grams, so, or maybe 70 grams of protein. So, which will get you, see, a egg gives you about 11 to 13 grams of protein. A chicken piece gives you about 20 to 30 grams of protein. So you can, you have rough indications for amount of, or you can consult a nutritionist for the right diet.
Yes, sir. Great. Thank you so much, Dr. Abhay, for covering that. I also want to cover on one more aspect of diet. It's emerging from our Indian ethos and upbringing, which is the various forms of juices our mothers project us to prevent different diseases, right? karele ka pani, say ginger ka pani, say different seeds ka pani, right? It is very, very common in India. What is it with these juices? Is there any science behind taking any of such juices to prevent diabetes?
Yeah, thank you. I'm glad you brought out this. And of 30 plus years of treating diabetes, I've not come across a single diabetic who's not tried Karele ka juice. Okay, so everybody, I tell them Karela is a good sabji, so you please have it in the form of vegetable.
Right.
The juice is basically one, it's very bitter. It'll suppress your appetite, so your next food intake is going to be less.
Right.
So you can have it. But certain things which are there, like methi ka pani, it contains a little alkaloids. It decreases the carbohydrate absorption after food.
Okay.
Certain times when you take methi ka pani in the morning, it's got a slight anorectic, so your appetite doesn't go up.
Okay.
So these have got a scientific basis, and if you look at the traditional foods, they have. But most of the time, it becomes a marketing gimmick that you find every park, and they will find a vendor who will be selling you karele and lauki ka juice.
Makes sense.
So basically, you eat karelas, you have that. That will also decrease. Take it in the form of vegetable because it's bitter. You will not eat too much. Methi ka pani or crushed methi will have some alkaloids which will decrease the carbohydrate absorption. So these things are there. There's some ethos to it, but not to just rush and leave your medication that I've started karele ka juice and pani and my diabetes will disappear.
Right. And also, Dr. Abhay, you touched upon a very important aspect, right? Trying to say order pre-created juices online or otherwise has had impact on people's liver function and led to different
You really don't know how they're being prepared.
Yes.
And what is the kind of metals or what ingredients they have been added. So if you want to do it, you please prepare it at home.
Right.
So you will know you got some fresh vegetables and taken it. Ordering it online has become, if you want a hairpin, you order it online. If you want a big meal, you order it online. So basically, that's the current trend of the society.
Right. And also because the regulations are a little loose in our country with respect to the quality aspects, it's very important that such things should not be consumed.
I think as a media platform, you can raise this kind of issue.
Yes, definitely, Dr. Abhay. And Dr. Abhay, we've also had cases because, we also treat a number of patients with diabetes at Zyla. We've had cases where people are crushing leaves like neem leaves without any boiling or any, cleansing aspect, which can also have diverse impact.
If you walk across the park, pollution is high, you take out leaves and crush them and take them. Obviously, you don't know what kind of ingredients you've taken with those leaves.
Yes.
So basically, everything which even when you bring vegetables home, you are supposed to first wash them, clean them thoroughly, and then cook them. So the same kind of philosophy which you have to follow, this is what our ancestors have taught us.
Yes, so it's good to follow Indian home remedies, but to a level where you're not experimenting with your body.
You do it at home.
Yes, and you do it at home in a controlled environment. Makes sense, Dr. Abhay. Thank you so much. Now, Dr. Abhay, touching on a very important aspect of people living with diabetes, right? And if people watching this don't have diabetes, they definitely have someone in the family who's grappling with diabetes. So we know that diabetes impacts a lot of organs like your heart, kidney, your foot, your nerves, right? So wanted to just throw some light on that why is it that diabetes impacts these organs and what are some of the early signs, right, for patients to know?
See, diabetes impacts practically every part of the body. One, it's a slow disease. It's a slow poison which is kind of mingling in your body and slowly the glucose will bind. Glucose is an energy-rich molecule. Now, as long as it's in the quantity which is there, it will be used in the form of energy. If it's in excess, it will go and start binding to different tissues and will change their nature. So basically, when it starts changing the nature, and predominantly diabetes affects the vasculature. If you have the bigger arteries which is involved, you call it macrovascular disease. So that affects the heart and the brain. So people are more prone to heart attack or cardiac failure, or people may get a stroke. If it affects the smaller arteries, the eyes, the kidneys, the nerves, they will get affected. So the key ingredient to this is the level of glucose. So if you keep your glucose in the A1C is below 7 or 6.5%, keep your glucose in the range of 100 to 150 or 120 to 160, your damage to the organs would be, or the vessels would be less, and you will possibly be able to live with diabetes in a more healthier manner. So there comes the importance of assessing of the target organ on a regular basis, modifying the therapy based upon which target organ is involved, and reassessing it whether the disease has progressed or not. So it's an ongoing disease. It's a disease which is not going to disappear. It's a disease which requires regular reassessment and re-evaluation of kind of treatment. And if there's if the kidneys are involved, the therapy has to be tailored accordingly. If somebody's got a heart disease, then a visit to the cardiologist assessing the cardiac condition, and if there's a peripheral arterial disease, if the neuropathy is setting in, controlling diabetes and treating the neuropathy becomes important.
Got it. Got it. So, are there any specific regular checkups, Dr. Abhay, that a pre-diabetic or diabetic?
So, you have to have a primary physician who would be looking after your diabetes. That physician will assess you both clinically as well as the metabolic parameters which you come, reassess your treatment, and as and when there's a involvement, what you call is a target organ involvement, whether it is heart or kidney or nerves, would involve the respective specialities, whether cardiology, nephrology, neurology, or gastroenterology, whether it's a fatty liver. So these would be done by the predominant primary physician, endocrinologist or a diabetologist whom you visit, or a primary physician who's been treating you diabetes very well, would do the assessment and would require. So it's important that once you've taken the treatment, don't forget that everything is okay.
Got it.
So you have to reassess it on a regular basis and reassess the treatment also with the concerned doctor.
Got it. Got it. Thank you so much for that, Dr. Abhay. And just talking about the symptoms that diabetes poses, there are a lot of symptoms that create a lot of nuisance in a person's day-to-day life, right? It impacts the quality of life of a person. At Zyla, we have seen two key symptoms, sir, that people report very often. One is numbness or pain in the peripheries, and the other is urinary issues. Very, very common for people who have, as you said, deranged glycemic levels or glucose levels. So how do you guide patients to manage these?
See, numbness is a form of neuropathy.
Yes.
If your glucose is high, the nerve conduction gets affected. So that particular part of the body is not conducting, or the sensation is not coming from that body, so the numbness happens. So the first is to get your glucose under control. Secondly, you have to decrease the amount of numbness. That would be done based upon the degree of involvement of nerves is there. Second, you said, is the urinary symptoms. If the glucose is above a certain threshold, that is renal threshold, which may be 160, 180 milligrams, then the glucose is going to go out of urine. Along with the glucose, you'll have a lot of water going out, so polyuria, that will be a sign. Another sign is people getting up in the night because the third is now you have drugs which throw glucose out of the body, that is SGLT2 inhibitors, that will also increase the symptoms. So based upon what is causing the symptoms is important. But if your glucose is under control, if you are managing your diabetes, most of these symptoms can be taken care of.
Got it. Got it. Okay, so Dr. Abhay, that brings us to a very interesting segment in the conversation, which is around innovation and technology, right, for diabetes, because this is one disease where enough research has been underway for years and decades, right? So, what are the most exciting innovations that have happened in the recent times for diabetes prevention or monitoring or treatment?
See, a number of things have happened. This is 2024, 1921, we had the first discovery of insulin. That changed the way you treated diabetes, and then there have been a number of innovations in the kind of insulins, the way you do insulins. When I did my DM, we had just 2 or 3 drugs for treatment of diabetes. Now you have 8 or 6 classes of drugs, which you can use effectively depending upon the abnormality which the patient has. That is as far as the therapy is concerned. The next is the diagnostic aspect. Now you have glucoses, A1Cs which are available. You can do home glucose monitoring. You know what exactly. You can do what is called as continuous glucose monitoring. So 24 hours the patient is known. Then there's innovation as far as the delivery of treatment is concerned in the form of pens or in the form of insulin pumps. And now we'll have more genetic switches which are going to come. Maybe there are lot of innovations which are available, which are going to come in this field. It's over a period of time we'll come to know as things keep coming by.
Interesting to know that, Dr. Abhay, insulin is just 100 years old, right? And it's so amazing to know that it's actually very recent, if you see, right? You touched upon continuous glucose monitors, right? So, Dr. Abhay, there is a lot of trend in the market. Even the fitter people, athletes, people who go to the gym often, who are trying to lose weight, who are counting their calories, to use CGMS devices. What is your take on the efficacy of CGMS devices?
See, CGMS is, as it says, continuous glucose monitoring. So continuous glucose means it's got a reagent which will be measuring the glucose every 5 minutes or 15 minutes, and all that data will be stored in the chip which is there, and with Bluetooth it's going to communicate either to the device or on your mobile app, where you will come to know what the glucose is. CGMS is very helpful if somebody is on insulin. And if somebody is on insulin, you want to prevent hypoglycemias, you want to prevent high sugars, hyperglycemia, you want to keep the glucose in range, which is called time in range. It is very helpful. Secondly, patients who are on multiple drugs, where you would like to know whether the glucose is going out of range. Gestational diabetes, where you want to keep the glucose under control, and patients are on insulin. This is where the CGMS has kind of revolutionized the treatment. It's facilitated the doctors to know what the abnormalities is, and it also has helped the patient. Now, you talked about gym people using CGMS to look at the calories. That I really don't think it really makes a difference in knowing all this. Maybe a certain diagnostic tool, you want to know whether the glucoses are going up, you want to know the kind of foods which will increase, but as a tool, we should restrict it to use as per the physician's advice. Somebody who's got diabetes, who's on 1 or 2 drugs, he's maintaining very well. I really don't think the CGMS is really going to change the management. You would like to know more for scientific purpose but if somebody is deteriorated from a good control to abnormal control, you would like to use a sensor which lasts for about 15 days to know where the abnormality is. What kind of food pattern is increasing the sugars. That will make a difference. It's a good tool at your hand, but it should be used in the right manner. Just because it's available, everybody puts in a CGMS, puts on a patch and keeps checking it every 10-15 minutes, I don't think really makes a sense.
Okay, so things have to be done as per the need and as per the doctor's advice.
As per the requirement.
Yes, great, Dr. Abhay. So we touched upon the diet aspects, the exercise aspects, the overweight aspects. We've missed a very important aspect of a cause linkage to diabetes, which is stress. Right, and we have a lot of people who are living with very busy work lives in very long working hours. They may be having family plus professional stress. So what is, according to you, the correlation between stress and diabetes?
See, stress, couple of ways this stress can worsen any disease condition, whether it's hypertension, whether it's heart disease and diabetes. One is it changes your normal day-to-day circadian rhythm lifestyle. So you may not sleep well, that has an effect. Second, it changes the kind of meal pattern which you Third is, if you look at the biological markers, stress induces an increase in cortisol secretion. And cortisol is a counter-regulatory hormone which increases the glucose levels in the body. So stress and stress management does play an important role. So basically, de-stressing yourself, going on a holiday, going on a hike, so that increases your positive hormones, which is called the endorphins and enkephalins. So basically, but stress is a part of daily routine youngsters I see, they're under a lot of stress these days because of the job, profession, leaving our jobs. So basically, they have to kind of give little more amount of physical activity, get some design. So that stress, the work pressure should not change your meal pattern and meal routine. And maybe I may not be right person to do your work slightly more efficiently.
And Dr. Abhay, in today's work life, there's a lot of prevalence of smoking and alcohol as well, right? Do you think there is a correlation with those and diabetes prevalence?
See, diabetes prevalence may not be directly linked with smoking, but smoking does harm you in the form of, because diabetes harms your vasculature, has an effect
Heart.
on the heart and lung. So does the smoking. So smoking is basically has to be done, and readily every 500 meters you find a alcohol shop. So that increases the quantity. So everything has to be done in the appropriate, in a moderate manner, and that has to be stressed among the population.
Got it. So you're saying,
So be a social drinker, not be a compulsive drinker.
okay.
Limit the quantity of alcohol depending upon your physical condition, depending upon what you can consume.
Yes, the audience would love you, Dr. Abhay. You allowed them to socially drink at least, unlike
In small quantities.
Yes, thank you so much. So Dr. Abhay says that smoking and alcohol sort of increase our pace of complications of diabetes.
Smoking is best avoided. I think it's a most harmful thing to be done.
Yes. And Dr. Abhay, when we talk about patients on certain medicines, right, does that do certain medicines also impact other organs? There's a lot of myth floating around, medicines impacting the liver or kidney. How much of this is really true?
See, it's a question of medicine and side effect. Every medicine comes with a side effect. So when you look at the patient, whether the patient is, so you decide based upon, some patient may not tolerate metformin because of GI or gastrointestinal side effect. It's a disease which affects the kidneys, not the medicine. And the disease also affects the liver. Some medicines may not be too good for the liver, so they have to be used in. So the doctor who's prescribing knows the effect and the side effect, and then based upon what the patient's condition is, you use those medicines. And if there's a liver or kidney disease, or if the patient is pregnant, you can't use every medicine. So you have to use medicines which will not be harming the kidney and liver further, and especially in pregnancy that you are left with insulin and metformin, so you have to change the kind of medicine depending upon what the patient requirements are.
Thank you, Dr. Abhay. You touched upon a very important aspect of pregnancy and diabetes. So just focusing on that for a little bit, is there an increase in gestational diabetes, as we call it in India, and is there any guidance that you have for that?
So there's a documented increase in diabetes occurring in pregnancy. Any diabetes which occurs in pregnancy is called gestational diabetes. Now earlier the age of marriage of women in India was between 20 to 25. Now it's moving between 30 to 35 or late 20s and early 20s. The jobs, the careers, so the first pregnancy is getting delayed in the early 30s. So as the age goes more than 30s, the risk of gestational diabetes increases. That is one factor. Second factor which contributes the higher prevalence of diabetes in pregnancy is the weight. So as the lifestyle changes, as the weight increases, and pregnancy adds on to your insulin resistance and insulin deficiency, and that increases the incidence of diabetes. So diabetes abnormalities or glucose abnormalities or in pregnancy is becoming much more common, and earlier we used to see, let's say, about 5 to 6%, which has gone almost more than 2 times or 2.5 times of that.
Wow, it is more than 10% now.
In bigger cities, yes. So general Indian prevalence of gestational diabetes would be, anyway, offhand I don't remember, is between 8 to 12%.
Got it. And Dr. Abhay, touching upon this, further, I wanted to just bring to the table an important aspect of the demographic bit, right? So male versus female, or even age-specific risk. Are there insights for India that we have with respect to whether females or males are more prone to diabetes, or is there a particular age today, or it's similar across age brackets?
See, it's it depends upon your genes. So if there's a hereditary or there's a family history of diabetes, the siblings are going to get it a decade or a decade and a half earlier.
Okay.
If the parents got it at 50, there's a chance that these offsprings would get it at 35 to 40. So that is one. Secondly, male to female, it's not so much of difference which makes. It depends upon the lifestyle and the food which you eat. And it's the obesity, and that makes you. Because of the estrogens, the females have slightly lesser risk of cardiovascular disease, but once the diabetes happens, the risk for cardiovascular disease also increase.
Even before menopause?
Even before menopause. And it's the younger people who generally tend to be lesser physically active and who have overweight, who don't eat right, and what you talked about smoking and alcohol in larger proportions, they increase the risk of obesity, overweight, and then diabetes.
And Dr. Abhay, you were talking about food habits and lifestyle early on. We have a lot of young audience watching this show, people in their 30s, 40s. What is your guidance on food ordering or immediate food that we crave and we eat, and how should we get that in moderation?
So, younger people, I would like to advise that one, regulate your lifestyle. Secondly, follow a kind of timetable which should include some kind of exercise, which should also include some. I don't find younger people playing too much these days, and so have some kind of social interaction in the form of games. Everybody is going to a gym. Going to a gym doesn't really mean, but yes, some physical activities, right? Eat right, eat healthy, ghar ka khana as far as possible. The outside food which is available, yes, you may order, but pick and choose the kind of food which you eat. And if you really want to eat a high calorie food, then please exercise and earn your calories.
This has been a wonderful educational session, Dr. Abhay. Thank you so much for sharing your lifelong learnings with our audience today. I am sure that our audience will be able to inculcate some of these in their day-to-day. To our audience, I would like to thank you for being with us. I hope that you make the most of these valuable learnings. I hope you're able to prevent diabetes. And if you or a loved one is dealing with pre-diabetes or diabetes, I hope that you can make the most of these inspirational anecdotes that Dr. Abhay shared today. Thank you again, Dr. Abhay and Manipal Hospitals, for helping us educate our audience.